Very common feature of fetal alcohol syndrome. So what are some things that we can encourage? We can encourage our patients, like we talked about, there are pharmacologic therapy, and then there's non-pharmacologic therapies. There's counseling. There's also treatment with their physician. There are medications that they can use that can diminish the cravings and make the withdrawals smoother. What we want to make sure in counseling our patient is that we keep their confidence. We don't judge. We definitely become a good resource for them when it comes to seeking aid. And like smoking cessation, tobacco cessation that we talked about, we really are there to help guide them in getting help for all alcohol misuse or dependency. And I gave you a slide that's kind of interesting. It's a neat way to gauge alcohol use. It talks about the concern. Has that person been concerned about their drinking? Have you ever felt that you should cut down on your drinking? Is it apparent to others that there is a problem? Have you ever become annoyed by criticism of your drinking? Do you feel guilt about it? Some ways, those are self-evaluation questions. And do you have any evidence in your behavior that you're dependent? Do you need it first thing in the morning, like an eye opener? Get rid of a hangover? Do we bring this out and discuss this with every patient? No. It's when we get rapport, when we gain their confidence. So, what do we pay attention? On the dental hygiene appointment, we're looking at their appearance. Is there an odor? Are they shaking? Are they clean for their appointment? There are some signs on the skin. Many times the excess alcohol use leads to broken blood vessels. They get petechia, rosacea, a red flush, sometimes bloating, puffiness around the eyes. They could have trauma if they've fallen. A common sign is swollen parotid glands when we're doing EO-IO. You're feeling, you can feel those on both sides. It's not always the only symptom, so don't jump to conclusions. If that's what you feel, oh my goodness, pull out Cage, start talking to him. No. But you get the whole composite picture. So what are some common oral findings? Chylitis. Do you guys know what that is?
Fungal.
What is that?
Dryness of the corners of the mouth.
Yes. Chylitis can also be a sign of nutritional deficiencies, and in alcoholics, they can have nutritional deficiencies, or those who are dependent because they're not absorbing nutrients, specifically B vitamins, like they should, and so they get a higher increase of chylitis. They tend to also have caries from xerostomia. Alcohol is drying. Nausea, vomiting creates an acidic environment, and that does what? That brings up their risk for caries. Okay? You can get erosion and chipping from injury or attrition if they grind or clench. But the common findings would be chylitis, xerostomia, and increased risk of caries because of having an acidic environment, a dry environment in the mouth, and as a result of stomach acid from vomiting. What we pay attention to, just like we talked about with tobacco cessation, we know that it predisposes them to carcinomas, but the most common is the squamous cell. That risk goes up, and as we talked about earlier, when it's combined with tobacco together, it increases the risk significantly. All right. Where are we on time? Am I over?
Yes.
2:55, I'm sorry. We'll wrap it up here. We'll finish our last slides next week, and it's all yours, Miss Lee. All right. Okay, so everybody has their review and your competency. We handed those out today so they can start to become familiar for clinic with the tobacco competency. We're not starting this quarter, we're gonna start next. Okay, but we went through that. All right, guys, any questions on anything we reviewed? Nope.
Next week we're gonna have a
Quiz 2 on tobacco cessation. Yes, what we went over. You got it. Okay? All right, guys. Here you go, Miss Lee.